And Charlita, go ahead.
Okay. Good morning, everyone. This is Charlita Tavares, CEO of Primary One Health, and I want to welcome everyone to this morning's community health. Okay. This morning, everyone. This is Charlita Tavares, CEO of Primary One Health, and I want to welcome everyone to this morning's community health. Okay. Chris. Good morning, everyone. This is Charlita Tavares, CEO of Primary One Health, and
There we go.
Chris.
Yes.
It is reverberating.
Yes, I fixed it.
Okay. Well, welcome again, everyone. This is Charlita Tavares, and I would like to welcome everyone for our quarterly Community Health Advocacy Forum. I hope everyone has their coffee or orange juice or pancakes or eggs, and we're going to get into a discussion on education, addressing one of the social determinants of health for our community members. Our first speaker is going to be Dr. John Stanford, who is the Deputy Superintendent for Columbus City Schools. And he supports the superintendent's efforts to oversee the academic and business operations of the district. He also leads the Department of Administrative Services, which is comprised of the board, services, information technology, legal services, and policy and government affairs offices. Prior to becoming the deputy superintendent in August of 2012, Dr. Stanford was the district's chief operating officer. He held the COO duties until 2014, along with his duties as deputy superintendent. I'm going to allow Dr. Stanford to take it away. Welcome to our Health Advocacy Forum, Dr. Stanford.
Thank you very much, Ms. Tavares, for that introduction. That was really, really wonderful. Good morning, everyone. On behalf of Superintendent Dixon and our Board of Education and the 50,000 students of Columbus City Schools, I thank all of you for allowing me to be here this morning to share our educational program in Columbus City Schools and how that educational program is so important to the health and wellness of our community. As you know, on March the 13th, Governor DeWine ordered the closing of all K-12 schools across the state of Ohio. Like many of the districts around the country, Columbus City Schools had to pivot very quickly to transition to total online learning, something we were not fully prepared to do as a school district and even as a community. We quickly set up grab and go meal sites to provide healthy free breakfast and lunch for our families across the community. We repurposed the existing stock of Chromebook devices in our districts to loan them out to families in need. And we were fortunate enough to receive donations and to purchase additional hotspots to provide Wi-Fi access to those households so that they could access the learning platforms that were quickly put into place. Despite the heavy lift, our teachers were able to connect with and engage with students with innovative lesson plans to finish out the school year. And we are so very, very proud in Columbus City Schools to say that with the class of 2020, we graduated over 2,200 students this spring through a virtual graduation ceremony. We continue to build upon our successes over the summer with our first online summer school platform for summer school. Families signed up for the program and were totally engaged throughout the entire summer. As a result of our efforts at the high school level, we're able to celebrate close to an additional 100 summer graduates this summer. They will have a virtual graduation ceremony this evening at 6:30. These seniors have worked hard this summer to complete their course requirements through the district's virtual summer school program. You can join in on the celebration this evening. It will be live streamed on the Columbus City Schools Facebook page and YouTube channel, aired on the Columbus Educational Access channel. Make sure to check your local listings for the Columbus Educational Access channel in order to join us. It will also be simulcast on WCBE which is the Columbus City School Board of Education radio station at 90.5 FM on your radio dial. We encourage all of our families and community members to use the hashtag CCSGrad2020 when hosting virtual graduation watch parties and sharing posts on social media. As you know, the United States continues to see a spike in daily deaths due to the global pandemic. The CDC reports nearly 1,500 lives each day are lost across the nation. From a public health perspective, the flu could have a large impact on COVID-19 as the summer season turns to the fall. And we know that in Franklin County, we have one of the highest positive test rates in the state of Ohio. And it's something that we are working very closely with our Columbus Public Health Department in order to make sure that we are providing the type of protocols and safety guidelines for Columbus City Schools. A lot of thought and effort working with the Columbus Public Health Department went into the planning for the safe start to this school year. Following the guidance and recommendations of the Columbus Public Health Department, Superintendent Dixon decided to start the school year with a fully remote instructional program. The last thing we want as a district is to open our district irresponsibly. So we are watching the science. We are connected with Columbus Public Health to provide us guidance every step of the way, and so that we see that the number of COVID-19 cases continue to decrease in Franklin County within our boundaries as a school district. Dr. Dixon is updated every week with the various community leaders on information regarding COVID-19. And so as I indicated, we will be starting remotely starting on September the 8th through October the 27th. The reason for the September 8th start time is that we will start the school year this year by providing 10 days of professional development for all staff across the district. Yes, all staff across the district. Almost 10,000 staff members in Columbus City Schools will receive professional development before the start of this school year in order to provide additional training on how to work in this virtual environment and under these COVID-19 restrictions. We are rolling out a new curriculum that our teachers will be using this year, which is a part of the reason for this 10 days of professional development for our teachers and other instructional staff. We're also rolling out the protocols and the safety guidelines that we want all staff to participate and to support as we start the school year. We also want people to be very comfortable working through this virtual environment using the various different virtual platforms in order to continue their work and also to educate our students. We have not seen many of our students since March because of the governor's order in March. We absolutely miss interacting with them, and I believe some of them miss being with us as well. And some of them may be enjoying this time off, but we do dearly miss them over the past few months. But we know that this has been a traumatizing event for all of our students and our staff members. And so we are going to use the technology to connect over the summer and to make sure that we are using all of the tools available to make sure that our staff and our students are healthy and dealing with this COVID-19 experience and dealing with the traumatizing effect of the experience of being online virtually. We are aware that these are complex needs from our students and our staff members, and that these are complex communication capabilities that we are asking them to engage in. The district is continuing to research the equipment that might be necessary for students to access their education from home and for our staff members to engage in their work from remote settings as well. The parameters of the IEPs and 504s for our students with disabilities will be followed to the best of our ability with the remote learning settings that we have. For example, that could include individual or group meetings, group remote settings with special pathologists or exercises to make sure that they are experiencing healthy learning through the remote experience. We also want to take the time to thank all of our community partners. They have been so inspiring and so encouraging and so supportive during this challenging time. They have stepped up and wrapped their arms around the district. They know our students and families are essential, and they have really engaged with us to support our families. For example, this spring, a community partner stepped up to provide additional hotspot devices for our families that did not have access to Wi-Fi. We've had partners who purchased extra food, even though our food service team stayed on track and provided free breakfast and lunch. Those partners stepped up to provide free meals for dinner and over the weekends. We have a new Department of Engagement through the superintendent's reorganization last year that is working with our partners to provide additional resources for our students and our families. We want all of our partners to reach out to that engagement team in order to assist us and to provide additional supports for our students, especially during these first 9 weeks when our students will be working remotely. For instance, we are partnering with community organizations during that first 9 weeks to provide community learning engagement centers. Those community learning engagement centers will provide additional support and additional resources for our students so that they can be engaged in their learning outside of their class time with us. Those who are interested in supporting our efforts, please email our Department of Engagement at engage@columbus.k12.oh.us. Also, a huge thank you to the City of Columbus for providing $7 million this summer through their CARES Act funding to help the school district purchase additional Chromebooks. Through that effort, we're able to purchase about 20,000 new Chromebooks for our students to utilize this fall. So again, we know that health and wellness is absolutely important to the well-being of our students. Education is an important part of not only supporting the health and wellness of our community, but it's also important in educating our students about nutritional habits, health habits, and wellness habits. Our Department of Health Services partner with our health and wellness community on a regular basis through the school year. Primary One is one of those partners that we partner with, and we look forward to continuing to partner with our partners throughout the school year to continue to provide the best health and wellness environment that we can provide for our students, especially during these trying times under COVID-19 restrictions and pandemic. And so you can find updates about the safe reopening of our schools this fall by logging on to www.ccsoh.us/reopening. There at that site, you will find a robust collection of videos and other resources to answer any questions that you may have about the safety and wellness protocols and guidelines and steps that we are taking in Columbus City Schools to protect our students and staff during this COVID-19 pandemic. I think I am out of time at this point, and I will turn it back over to Ms. Tavares. And thank you all again for allowing me to participate.
Thank you very much, Dr. Stanford. Thank you for the work that you're doing with our children within the Columbus City School District. I have a question, and then I'm going to ask Chris if there are any questions. If you are interested in providing a question to Dr. Stanford or any of our guests this morning, please go to our YouTube chat, and that way you can enter your questions to the members of this morning's panel. Dr. Stanford, we've talked about what's happening with Columbus City Schools, and certainly the partnerships are critically important, and that Columbus City Schools is going to have a virtual online classroom for our children, and that will start on September the 8th. Are there other ways that community members can help our children prior to their starting their classes?
Thank you for that question, and it's a wonderful, wonderful question. Yeah, this is August is the traditional start of the school year for school districts, and so typically during this time of year there would be plenty of back to school events and fairs and community events. There would be efforts to collect book bags and collect supplies for our students. And I would say those type of efforts are still, helpful for our students and our families. Because everything is virtual, they will still, be in need of those type of resources and supplies, even though they're at home. One of the efforts that I know is going on right now is with Columbus Channel 4, NBC4, to make donations to provide those type of supplies and additional supports to our families. And as I said, any effort to support our families and our students can be directed to our Department of Engagement. Our Department of Engagement has stayed engaged with our families throughout the entire summer through teleconference webinar sessions to keep them informed. And so if there are efforts to reach out to our families and to make resources available to our families, please contact our Department of Engagement by emailing them at engage@columbus.k12.oh.us. If community organizations want to develop virtual platforms to engage our students in sort of back to school learning opportunities, again, contact our Department of Engagement to see if there are opportunities to do that, especially organizations like Primary One that are focused on health and wellness. If there are opportunities to provide nutritional guidance and direction to our families during the time that they are not picking up meals from us, like on the weekends and in the evenings, again, our Department of Engagement will be able to work with you to provide that opportunity to work directly and to have direct contact with our families and students.
Great. Dr. Stanford, many people don't understand that if we don't prepare our young people at the earliest age possible, prepared to learn with the supplies, as you mentioned, NBC4 has a book, a Step the Backpack with Primary One Health that's taking place now. We really need individuals to understand that the parents need these supplies to help their children during this pandemic and to help them at home prepare for their online courses. And if our young people don't get that jump start and be prepared as they get into the virtual classroom, they're going to fall behind. And that's going to certainly inhibit their ability to be successful as a young person, and it does have an impact on that young person's health. It's also important right now because parents are taking on double, triple duties that they get the support. So we don't want them to worry about getting those backpacks. So I do want to stress that if there are listening audience members who would like to help the children of Columbus City Schools and other school districts in Franklin County, we are working with NBC4, Primary One Health, and other partners to either collect those donations so we can prepare a book or a backpack for each child in Columbus City School District, as well as those other districts in Franklin County. And $10 will provide a backpack for a family, and $270 will provide a backpack for every child in a classroom. So those are important. You can go to NBC4's website. You can go to Primary One Health website. And as Dr. Stanford talked about, they have the Department of Engagement, and we'll make sure that we have that link and share it out with everyone that's on the call. You can contact Primary One Health. We'll make sure we have that contact email available so that you can make those initiated collaborations with Columbus City Schools. Chris, do we have any other questions for Dr. Stanford at this time?
We do not have any questions in the chat box, so at this time.
Well, we will move on, Dr. Stanford, to our next panelist. And if you can stay on the line, there may be questions after Brenda Rivers. And I'm going to introduce Brenda Rivers. We talked about K through 12 education. We're going to move on to our younger children within our learning environment. Brenda Rivers is the president and CEO of the Child Development Council of Franklin County, Inc. The CDC, Franklin County is an elementary or secondary-based school in Columbus, Ohio that was founded in 1985. The Child Development Council of Franklin County is a child and family education and enrichment agency offering Head Start, Early Head Start, and adult programs throughout the greater Columbus area. This is really a family-focused program. Dr. Rivers, I think I gave you a new title. Ms. Rivers, thank you very much for joining us, and you can share your thoughts about how early education has an impact on the health and well-being of our children and families.
Thank you, Charlita. And I have a PowerPoint presentation that kind of helps guide the discussion. So I'm going to wait for Chris to put that up.
Where'd it go? 1 second till I find it. This is not it.
And I'd also like to thank you, Charlita, for giving me this opportunity to talk about Head Start and early childhood education, because Head Start is probably one of the best kept secrets in the country.
I would totally agree. I think it's critically important, and quite frankly, the Head Start program came out of the war on poverty, just like the federally qualified health centers like Primary One Health. They were all a part of the war on poverty to address, they didn't call it social determinants back in 1965. However, we've learned today that all of these are interconnected. And if we want children to be ready to learn and adults to be ready to earn, we're going to have to emphasize the social determinants, education, housing, employment, business development, community development. All of those impact the quality, and certainly healthcare, the quality of health and well-being. So as Chris puts up your PowerPoint, I will give it back to you, Ms. Rivers. Brenda, thank you very much.
There we are. So you see behind me and on the screen, as Charlita mentioned, our agency has been in existence since 1985, founded by Mrs. Maddie B. James, and this year we're celebrating our 35th anniversary. So in spite of the interruption of COVID, we are still reminding ourselves that we have been in existence for 35 years and going strong and hoping for another 35 years. So you can go to the next slide, Chris. Our mission is to enrich the lives of children and families. And the key word here is and. We work with children and families. This has been the value of Head Start since 1965. And health and wellness has always been a component of Head Start since 1965. Okay, Chris? And I thought it was important because this is an opportunity to talk about our agency as well as early childhood education. And we have about 8 beliefs, but I thought that I would highlight just 2 of them. And this really mirrors what Charlita was saying. So one of our beliefs is that children and youth must be our country's highest priority for the investment of time, money, and resources. As we all know, children do not vote. And so often they have to rely on other people to advocate to get their needs met. Our other belief is that our families deserve the same respect, social benefits, and access to resources as families from any community. So therefore, our agency is committed to quality, integrity, and continuous improvement of the programs we deliver. And I just wanted to kind of give you a sense of how we operate on a daily basis. Next slide, please. Excuse me. So who are we? We already know Child Development Council of Franklin County, often referred to as CDC Head Start. I already mentioned we were founded in 1985. And if you go right to the bottom of the screen, unbeknownst to many people, we actually operate 24 full day and part day centers throughout Franklin County. Now, we do not do this alone. We actually have 5 centers that are in partnership with Columbus City Schools. We are also, we have 2 classrooms in Dublin City Schools. We have 2 classrooms in Worthington City Schools. We're in a very strong partnership with the Franklin County Board of Developmental Disabilities. We're also in churches, rec centers. We're anywhere that the children are. We also have 33 child care partners within Franklin County. We offer home-based services, and that is where a teacher goes into the home once a week for an hour and a half and works with the parent and the child. And of course, I'm going to talk about COVID later. Of course, this looks a little different now. And just as a frame of reference, we have 415 full-time and part-time employees. Next slide, please. So let's talk about the foundation a bit of Head Start. What makes Head Start very different and how we started was we offer comprehensive services for children and families. And these include, we serve pregnant women, infants and toddlers, and preschoolers. So obviously our first charge is kindergarten readiness, which I'm sure Dr. Stanford is happy to hear. But the other major component of what we do has to do with health and wellness. So every child has to get a physical exam, and that's also a requirement by the Ohio Department of Job and Family Services for all child care centers. Every child has to have a complete physical. For Head Start though, every child also has to have a dental exam. And people often find this puzzling because they say, well, the children's teeth are just going to fall out and they're going to get new ones. Well, it's not that simple, because poor oral health can interfere with the child's ability to learn. And just think, as adults, if you have a toothache and then someone tries to teach you geometry, you probably will not learn anything just because of a toothache. So oral health is very important. We also do vision screenings, speech screenings, hearing screenings, and behavioral screenings. And just to put this in perspective, in just a year, program year, we had over 100 children that needed glasses. So you can imagine, if this was not discovered early, a child would have gone on to kindergarten unable to see. But this is part of why we do all of these screenings, is to mitigate any issues a child may be having this early on. We also provide nutritious meals daily. They are hot meals for the children and a variety of meals so that they're exposed to a variety of foods. We also have social services available for families. So again, if a family needs a referral for housing, employment, mental health, whatever it may be, we provide referrals for that.
My little mouse.
We also serve children with disabilities, especially children that have IEPs or IFSPs. And we also provide mental health services, and that could be in the form of counseling or support for the classroom, whatever is needed. Next slide, please. A little bit more about who we are. We are governed by a board of directors, but another important part of Head Start is that we have what is called a policy council, which is a parent-driven governing body, which is made up of 51% of our parents, as well as community representatives. And their role is really decision-making. They decide about our grants, salaries, any major decisions we make, they are part of that, and we have to get approval from them. So it's not just a rubber stamp situation. The Policy Council is very important because they have input in terms of our programming, because who best to tell us than the consumers? Our funded enrollment is 2,168 Head Start, which again are preschool ages 3 to 5. And then we have 120 early Head Start, which are pregnant women, infants, and toddlers. Our eligibility requirement is 100% of the federal poverty guidelines, which, just to put this into perspective, for a family of 4 is $26,500. That is the 100% of the federal poverty guideline. And as Charlita already mentioned, Head Start began as a War on Poverty program. And so we are still going strong in terms of serving the most vulnerable and low-income families in our community. We are permitted to have 10% over income students, and our agency typically does not reach that level. Next slide, please. So let's talk about the relationship between education and health. And frankly, this is just very simple. Poor health can interfere with learning. And just like the example I gave about the toothache, the same thing goes for physical. So if a child is hurting or not well, and I'm talking about physically as well as emotionally, it is obviously very difficult for a child to learn. And if we just think about ourselves as adults, you know, we shut down when we have a headache. You know, we just don't talk to me. No, I don't want to go to a meeting. I don't want to be bothered. And so we are asking children to learn very complex things. We want them to problem solve, get along with their peers, all of these things when they're not feeling well. So this is just very simple. Poor health can interfere with learning, and we want to do everything we can to remove the barriers for children to learn so that they are ready, not just for kindergarten, but also lifetime success. Next slide, please. So I want to just talk a little bit about early childhood education and health. So by the age of 6, children achieve 90% of their adult brain volume. And we know there's been a lot of work going on about brain development and what happens between the ages of 0 to 5 and how important that is. So the factors that can impact a child's health, the number one thing is trauma. We know that trauma is now at the forefront because early childhood trauma impacts adults. And all the trauma work that is going on now, and actually how the trauma work started was with adults and their health, and just as an example, heart disease, and how in some people, this can be traced all the way back to early childhood trauma that is now showing up as heart disease, high blood pressure, diabetes, obesity, etc. So that's why it's very important to address these issues early on and increase resiliency skills for children as well as their families. Another factor, of course, is lack of access to healthcare and treatment. And Primary One is doing a great job. You're in neighborhoods where the families and the children are that need it the most. But this is obviously an issue still. The lack of access to care and treatment, and that can also be attributed to lack of access to health insurance. The environment is also obviously a factor. That includes where children grow up, violence, what's happening in the neighborhood, stability, water, the chemicals in the air, all of those things impact a child's health. Housing is a huge determinant for children, where they live. And we often hear politicians and other experts talk about your zip code shouldn't determine your outcomes, but unfortunately it does. But fortunately, there's a lot of work going on to try to alleviate that as an issue. Another factor is lack of early development opportunities. So access to early childhood development, access to quality preschool is very important because, as you can see, it is so important for us to get to children early. And I don't care what their income is. It's important to get to children early. And then inadequate protective factors. So these would be things like a loving, caring adult, systems that are responsive to children's needs, and trying to just make sure that there are protective factors in place in the community for children and families when they need them. So all of these things impact children's health. Next slide, please. So I don't want to just talk about problems. We want to offer some solutions that can help to improve outcomes for children. So the number one thing would be quality early childhood education. Because one thing that we know, health habits are formed at a very, very early age. So the earlier we can expose children and families, the better. And the more control we have over improved outcomes. Comprehensive services, I already mentioned, making sure that there is a focus on physical health as well as emotional health. Screenings are a very important way to improve health outcomes for children. And that would be health as well as developmental screenings. Also, we need to name poverty and racism. We're at a time in our country right now where this is almost the number one issue. Poverty, needless to say, impacts health outcomes for children. And fortunately, our community is really trying to address this in a very strategic way. I know we've been a little interrupted by COVID, which actually highlighted the issues around poverty, but as long as we're naming it and making sure that we're addressing it and not sweeping it under the rug, we should be able to improve children's health outcomes. Also, racism has an impact on health outcomes for children. There's been a lot of research about the medical community, and I don't want to throw the medical community under the bus because they're very, very important, as we can all see. But there are some things that need to be addressed also within the medical community. And I feel that right now, they're very open to that. And so that's a good thing. And it will help improve the health outcomes. Again, access to physical and behavioral health care and treatment. The goal would be to try to reduce the demand, especially for behavioral health treatment, because it is very difficult to find professionals that specialize in care for children. That is a specialty. It is also a passion. People that want to work with children, it is a passion, but it is also a specialty because it takes a separate skill level to work with children, because you also have to work with their families. Healthy lifestyles, so promoting good nutrition, exercise, and just paying attention to being healthy helps to improve health outcomes. And it is possible to impact a 3-year-old. It is possible to have a 3-year-old develop new habits in terms of eating and exercising. And addressing childhood trauma. There are several organizations that, again, are developing a very strategic way for our community to address childhood trauma and, again, to mitigate what happens when children experience trauma. So the next slide, please. I was asked to talk about the impact of COVID-19. So just like everyone else, we had to abruptly shut down in March, and it was an abrupt shutdown. During the time that we were shut down, we developed a very, very detailed response plan. Obviously, we used the guidance from the state, the CDC, and the health departments that are available to us. We did reopen in June. We have 5 centers that are year-round. We reopened virtually and in person. Obviously with new protocols and procedures. And so, for example, parents are not bringing children all the way into the center. We are taking temperatures and doing health screenings outside of the center or within an entryway. Again, this is to decrease the exposure for everyone, our teachers as well as the children. Our classrooms obviously had to be rearranged to ensure social distancing as much as possible. You can imagine trying to encourage 3 and 4 and 5-year-olds to socially distance, but we had to move some things out of the classrooms and rearrange classrooms. We had to take out all common touch things, all those little soft toys had to come out. And children actually have their own bins where they are using their own items. And of course, they're still sanitized, but they're not having cross-contamination with their items that they're using. And I don't want to call them toys because they're actually manipulatives that they can have fun, but they're learning at the same time. We are operating under reduced ratios, even though the state of Ohio is allowing us to go back to pre-COVID ratios. We are only going to have 12 children in a classroom. That will be the maximum. That's for preschoolers, and 8 for the infants and toddlers. We also have reduced hours of operation. Again, just trying to mitigate the spread of the virus. We have seen a decrease in attendance. We are at about 68% right now of what our capability is. And we expect that that will probably continue when we reopen in the fall. So on September 8th, we have 12 centers that will be reopening. For the other centers, that we will be virtual. Our home-based program also is virtual. We are expecting probably about 60% again. But one of the things that we are doing, we are making sure that we are engaged with our families. And so like many other organizations, we did food distribution. We also had to do classroom equipment. That was one of the things parents said they did not have at home. And so we provided every child with classroom materials so that when we are working with the parents virtually, they actually have some materials at home that they can work with the children. So it's going to be very different for us. But I think the other thing that has happened with COVID is that with all the virtual, it has actually increased access for some people. So We were talking before we got on here how there's probably going to be a combination of in-person and virtual meetings, learning, because we're able to increase the opportunity for people who couldn't before come in person. Next slide, please. And so this is just kind of what we do every day, is just imagining a community where everyone can meet their full potential. And we're just trying to do our part to make that happen. And like I said, it takes all of us. We have about 100 partners that help us do this work every day. And for us, it's a passion, but it's also very important for our community and for our nation and our world to prepare our children for success in life. So that ends my presentation. And again, I thank you.
Where did Charlie go? All righty, coming back. While we're waiting on Charlita, I have a question for Dr. Stanford. Sandra Jackson asked, will each child get a Chromebook regardless of the size of their family?
Yes, is the short answer. The donation from the city of Columbus again has allowed us to purchase 20,000 Chromebooks, which will allow us to be one-to-one with our students having access to technology. We are also working with families to identify those who do not have internet access, so that we can work with community partners to make sure that our families also have access to the internet as well, because the device is just one part of it, right? The internet access is also a very important part of this program. And as we know, in many parts of our community, there has been a digital divide across the community for a number of years, really since technology and internet became one of the primary modes of transacting business. And so I believe Ms. Rivers talked a little bit about poverty and racism. In Columbus City Schools, we are tackling the issue of equity in our school district in partnership with others across the city to make sure that we are providing that equitable access to educational opportunities. And we just hired the district's first chief equity officer who started work at the beginning of this month and will be a major part of developing our strategies moving forward to make sure that we are providing equitable educational opportunities across the district. So thank you for that question. Really appreciate it.
Thank you, Dr. Stanford. Juliet Doris Williams says she appreciates the focus on ACEs, Brenda. And Sandra Jackson also asks, will CSS community learning centers include tutoring, recreation activities, etc.? Also, will the centers be located in areas for easy access for all students, regardless of where they live?
Is that a question for me or for Ms. Rivers?
I think it's for Brenda Rivers. I might not be. It might be for Columbus City Schools.
Oh,
It sounded familiar because she mentioned the learning extension centers, I believe.
Yes.
Yes, and so yes, we are partnering with community partners across the city to provide those learning extension centers. And yes, there will be a number of educational and recreational activities for the students that are participating in those programs. The partners are the ones who are hosting and driving the programs at those sites. And so we are just partnering with them to make sure that our students and families know where those sites are going to be and know that they are available for them to utilize, especially when they're not in learning sessions with us. And so these sites are designed to provide additional learning opportunities, but also additional activities for students to engage in and stay engaged and not have a lot of downtime on their hands, during this COVID-19 pandemic period. And so again, if you reach out to our Department of Engagement, they'll be able to provide you more details about those learning extension centers.
Great. Are there any other questions? Okay, Charlita had to step out of the Zoom for 1 minute. So let me find, I think we should, let me see if she's available quickly. I don't see her. So we have Dr. Mary Bynum. She is with the Franklin University. She is the head of the healthcare services there. And I'm just going to let her give an introduction since I don't have that right at my fingertips, and let her go on.
Sure. Thank you so much. Thank you all for this opportunity. I am Dr. Mary Bynum, and I am extremely happy to be here to talk about this very important topic, which is education and its connection to health. And we know that health ultimately can be a determinant of education. Now, when we think about education, we know that there are 5 key components. One of those being literacy. And literacy is our ability to read and to write. And unfortunately, in our society, there is still a vast number of individuals who have an inability to read and write effectively, which is extremely problematic. Secondly, our ability to communicate, or our language, is another important factor. And so when we have, or when we're not able to communicate our needs, etc., particularly when it's concerning healthcare matters or health matters, it plays a significant role. And when we think about other areas of the educational system, such as vocational training, it serves as an opportunity or an alternative for higher education. But as Ms. Rivers noted earlier, early childhood development is extremely important for individuals in our community in order to thrive. Learning and development in our early years is extremely impactful for education attainment. Individuals who are underdeveloped have a tendency to engage in risky behaviors such as promiscuity, smoking, drugs, and violence, and even alcoholism. We know that our environment, trauma, our social experiences all have a significant impact on our ability to develop as children. But it is high quality education that can combat many of these stressors. I know for myself personally, as a child growing up in Los Angeles, California, and Cleveland, Ohio, I came to learn very, very quickly that it would be education that could help me to succeed in life, to have a chance to make it through my circumstances. And I am extremely proud of that. And so there are so many benefits to education that is worthy of consideration. Education provides us with an opportunity not only to feed our families, not only to ensure that we have proper nutrition, but it ensures that we have access to the basic things to help us to function in all aspects of our lives. It helps us to make better decisions when it comes to our health, when it comes to our finances, and it affords us opportunities to excel within our communities and with our peers and with our colleagues. But most importantly, it extends our expectancy, our life expectancy, as well as improves our overall well-being. And so when we think about health and the connection to education, we know that poor health plays a major role in our academic success. In addition to that, our social environment creates additional problems for us as well. And so when we think about parenting and our geographic location, it not only hinders health, but it hinders education as well. And so the more education that we have, the better we are in accessing the things that we need to be successful, but not necessarily just to be successful, to have a level of stability. So what I've heard throughout my career is that many individuals feel that it's our healthcare system that impacts the outcomes when we think about health. And to some degree, that is certainly true. There are some elements of our healthcare system that is impactful. But when we think about education and we think about the opportunities that exist and the impact that it has on our quality of life and our health and our well-being, we know that Americans with less education tend to live shorter lives and have poorer health outcomes. In addition to that, they have a tendency to report chronic diseases more frequently. So diabetes, heart disease, et cetera, et cetera. And so we know that education plays a significant role in improving our health. Now, here is some nationwide statistics, some national data that I wanted to share with you, but I don't want you to read all of the numbers here that are presented on the slide. It's a little bit racy. But what I want to point out with this particular slide is that we have definitely made some improvements in the last 10 years or so. And yes, there are a number of individuals who are going on to complete high school and to pursue higher levels of education. However, when we think about it from, Ohio, we are above the national level in terms of individuals who are graduating from high school. But when we look at individuals who are pursuing an associate's degree or a bachelor's degree or an advanced degree, the percentage is much lower. And so we definitely have an opportunity in this particular area to really work with organizations to support or bring awareness to higher levels of education and the impact that it may have on our health. Adults without a high school diploma, they live longer than individuals with less education. And in addition to that, adults with less education have a tendency to be less productive at work. So this is impactful for our workforce. But they also report higher risk factors, such as sedentary lifestyle, or obesity, or smoking, or higher stress levels. And it is even more impactful when we think about racial and ethnic minorities. Racial inequality, unfortunately, is a primary contributor to the disparities that exist with education. And there are so many gaps that continue as a result of racial and ethnic groups not having the necessary resources that they need, not only in school, but also at home. Mentors are extremely important, and having individuals that we can mimic and who emulate what success looks like from an education standpoint is certainly important. But there are gaps that exist with having courses, the necessary courses, in order for students to be ready to attend college. And so students who have access to math and science and the college preparatory courses and technology and so on and so forth are more likely to seek higher levels of education. Here is an example of what that looks like for other racial and ethnic minorities as well. And as you can see, it is a pretty significant gap when we think about the accessibility of additional resources and supports for college readiness. And so if we create a system where individuals have the resources that they need, have the social supports, and have access to proper nutrition, as well as mentors and individuals in their community, the life expectancy improves with an increasing number of years of education for racial and ethnic minorities. And when we think about individuals who have higher levels of education, for example, 6 years or more, there is no significant difference when we compare Blacks to whites. I believe the statistic said it's about 4 years difference. And so promoting education opportunity is certainly going to be key as we continue on. So with that said, as the demand for lower skilled jobs continues to decrease, educating the population becomes even more important. Removing education barriers is key to improving health outcomes, particularly for racial and ethnic minorities. In addition, it is necessary for education to remain at the forefront of the policy agenda. By not investing in education will create long-term healthcare costs, but most importantly, we will continue to see poor healthcare outcomes. This will be extremely important for us to focus our efforts and our attention so that we can ensure that access to such things as health insurance, access to proper nutrition, access to safe environments is going to come to fruition for those who need it the most. We must also work very diligently to ensure our education environments include not only physical and mental, but emotional health supports as well. And lastly, most importantly, we must continue to collaborate and partner to ensure that we eliminate inequality that exists at all levels of our education systems. And with that said, I would like to thank you for this opportunity.
Thank you very much, Dr. Bynum, and thank you for your presentation. I do want to thank Chris for stepping in while I had to take off and do an interview with Channel 4 on our pop-up testing. We're talking about health and well-being of children and families, and your presentation really zeroed in on both the emotional and physical health of individuals so that they're ready to learn as an adult in the higher education system. The impact of those who don't have their basic needs met are going to have poorer health outcomes, and education is certainly one of those social determinants of health. Chris, do we have any questions before I ask any?
No, not at this time.
Thank you very much, Chris. Dr. Bynum, are there ways that primary, secondary, early education, and higher education can work more collaboratively, more seamlessly to address some of these social determinants with community partners?
Absolutely. There is certainly a great deal of opportunity. I think for us, the most important thing is that we introduce students at an earlier age to the education opportunities that exist. That's going to be key. I think partnering with organizations such as Franklin University, who really has a presence in the community, and who has the desire to ensure that we are focusing our attention on developing students at an earlier age and also building the infrastructure from a community standpoint that supports that. And so really putting our boots to the ground and developing opportunities to really connect students and provide the supports that they need, particularly when they don't have those examples that already exist in the home. And so that's what I would say to that.
Are there other suggestions you would have to expose our young people at an earlier age to higher education, whether it's parents bringing their students, their young people on campus to do a day in the life of a college student, or whether it's having some events for early learners to expose them to the math and science that they may need for whatever college they attend?
Absolutely. I can tell you within our organization, we are working diligently to establish what we would like to call connection programs. And through those connection programs, what we are doing is we are bringing industry leaders and educators together, not just for our students per se, but for the community at large. And the really, really nice thing now is that we have the ability to do that, virtually as a result of the pandemic. But in the future, hopefully in the very near future, we will be able to provide those sort of activities free to the community and free to anyone who may be interested to actually come and visit with us at our institution. We do campus tours. I personally mentor a large number of individuals, not just with our organization, but outside the community. A lot of folks can connect with us on our social media platforms. Just this week, I spent several hours just really trying to support and help young folks to make those connections and to understand the significance and the importance of their education. Whether that be, younger children, all the way up through adults. And we also sponsor summer camps and several opportunities for us to make those connections. And so, with that, I certainly encourage, folks to reach out to myself, my colleagues, and our institution. We are also proud partners of Primary One. And so anything that we can do to support the community and, bring those educational opportunities, we are willing to do that and make that happen.
Thank you, Dr. Bynum. I know we are very much interested in providing that information, whatever information on the summer camps, on those mentoring opportunities and other exchange opportunities for our young people to be exposed to higher education. When we get that information from you, we will definitely post it on our website. Are there any other questions, Chris?
Jeff asked, how do we reach out to the Department of Engagement at the Columbus City Schools? I know we talked about sharing that information on our website. And then Sandra asked, what will it take to create a system based on the information Dr. Bynum described with the Columbus City Schools? And I think we kind of touched on that in Charlita's question, if I'm not mistaken, but if there's any other comments.
Dr. Bynum, Dr. Stanford, do you want to take that one?
Well, I just wanted to say real quickly, the person that asked about how to get a hold of the Department of Engagement, again, they can email the Department of Engagement at engage@k12.oh.us. And if they go onto our website, they'll also find information from the Department of Education of how they can engage with the department as well.
Thank you, Dr. Stanford. Dr. Bynum, did you want to add any more comments?
Yes, for sure. I think that there is definitely opportunity for us to partner with Columbus City Schools. I do believe that we have a partnership in place, but it's going to be extremely important that we work together to advance that partnership. And also hearing from the community in terms of what their needs are is going to be helpful as well. And so I think that this is a great opportunity. I think the question was great. And I can honestly say that we will be looking at that very, very closely in ways and how we can advance those partnerships to meet the needs and the demands of the community.
Thank you very much. I do want to share, if there are no other questions, Chris.
No, none.
Okay. I want to share before we close out today's quarterly Community Advocacy Breakfast Forum information on the Minority Health Strike Force that was developed by Governor DeWine to address the disproportionate and more acute stages of COVID amongst racial and ethnic populations. The Minority Health Strike Force was named back in April, and there were 52 members on the strike force. I was one of those members appointed to the strike force, and I headed the healthcare subcommittee. We had 4 subcommittees. The report was released on the other day. That was on, I believe it was on the, might have been, it might have been on Wednesday, but it's the Ohio's Executive Response, a plan of action to advance equity. And there are 34 recommendations coming out of that report. There was an initial interim report back in May, late May, early June. But this is called COVID-19 Minority Health Strike Force Blueprint. There are 34 recommendations. I am proud to say that many of the recommendations that have been coming out of the community for years, since, probably back in the mid 80s. Some of those recommendations, including providing culturally and linguistically appropriate services, providing training in bias and implicit bias and culture and diversity amongst service and care providers. Many of the recommendations speak to what we're talking about today, understanding the populations that we say we want to serve, providing those services in the most appropriate way based on the racial, ethnic, or cultural backgrounds of those customers, whether they're educators or social workers or healthcare providers, that we want to make sure that all of us who are serving the public are doing it in the most appropriate way. There are recommendations dealing with the criminal justice system. There are a number of recommendations. We want to just make sure that this is broadly distributed and that everyone has a role to play. Just as the COVID mantra has been, we are all in this together. We are one. And for Primary One Health, our mantra is we are all in this together. We are one. Primary One Health. We've got to work on addressing these recommendations together. It's not just going to be the government, it's going to be our educational institutions, our private sector, our criminal justice sector, healthcare sector, etc. So I will make sure that these links to the report are put on our website. We want to do our part to share the report, the good work that was done by the task force. We want to make sure that the governor and his team have partners in the community so we can lift up and implement these recommendations. So we will have that information on our website as well. And then for anyone who has signed up for this health advocacy forum, we will send that out to you. So you will get the Minority Health Strike Force report, the blueprint. And then finally, I want to share with everyone that these are quarterly community health advocacy breakfast forums. Unfortunately, because they're online, we can't provide breakfast for you because that's always been an opportunity for us to share a community resource, a community caterer or restaurant, particularly racial, ethnic, and women-owned businesses, so that we can do our part to grow those institutions within our community. So our next one, and hopefully we'll be able to do it in person, but our next Community Health Advocacy Forum breakfast will be on November the 15th. If you have ideas that you would like us to discuss, please share those with us. But again, that's November the 15th. And it will be from 10 until 11:30. So I want to thank our guests, certainly Dr. Stanford from Columbus City Schools, Brenda Rivers from CDC Head Start of Franklin County, and Dr. Mary Bynum of Franklin University. Thank you all so much. And what other update on Dr. Mary Bynum? She has just joined the Primary One Health Board. We're excited to have her on the board and look forward to the wonderful work that she's going to do. Chris, thank you very much. And if there are no other questions, thank you very much, Chris, for all your work. And thank you everyone for joining us.
Awesome. And we're good.
What's your dark